why don't we go ahead and get started? There's the record. All right, hi all. Thanks again for joining us. My name is Dave Javid with Plan to Place, part of the consulting team helping put on these series of meetings that we've started a couple days ago and we'll be going on the next couple weeks. These are a series of meetings that are leading up to the preparation of different elements of the general plan. And tonight's meeting is about health, environmental justice, and equity. So before we get started, we typically like to have our Spanish interpreter read this slide. We also have Spanish interpretation, and then we'll get started.
Para los que hablan español, por favor, en la parte de abajo de su pantalla de Zoom hay un globo, hay un icono que se ve como un globo. Por favor, haga clic en el icono que dice interpretación y así pueden escoger entre inglés y el español. Por favor, haz clic en el icono del globo para escoger el español como lenguaje y habrá interpretación en simultáneo. Gracias.
Thank you very much, Jasmine. And with that, we now have the Spanish room open. So we can go on to the next slide. So yeah, as I mentioned earlier, tonight's meeting on the South San Francisco General Plan Update process is really to provide you all with a brief overview of where we've been throughout the process and where we're headed. And this real important stage in the process where we develop policy frameworks for a series of different topics that we'll talk a little bit about those that we've already presented, what we're presenting tonight, and what we'll be presenting in the future. As part of this too, we like to have an interactive live polling sessions with you all throughout the meeting, just to kind of gauge your interests and some of demographic questions as well, just to get a better understanding of who you all are and your interests. And then most importantly, we'll move into small group discussions, depending on the number of folks that actually join us tonight. Typically, we like to break out into small groups to give you all plenty of space to provide us with input. We have a good chunk of time set aside for that. If it's a smaller group, we might all stay together here in this main room and have a discussion that way. We'll walk you through a few discussion prompts and really open it up for questions from you all. And then we typically like to have a report back again, depending on the number of folks that join us. We'll do that and talk through next steps and other meetings to come. And then we'll wrap it up right around 7:30. So next slide, please. So yeah, as I mentioned, these community conversations are really meant to provide an overview of the process, the technical analyses that have been put together at this really important stage, and how that's going to be leading into future phases of developing elements of the general plan. They're really going to be based on these discussions that we're having with you all today and that we've had before and will have in the future. Really to understand key goals and policy measures as we move through this process. And as you can see, here's a few images of the last major round of community workshops that we've had. Next slide, please. So we will have an opportunity, as I mentioned before, with live polling, which we'll do here shortly. Again, it'll be an opportunity for you to all to interact with us in a very kind of creative way. And then we're also going to have the chat function open throughout this meeting. So feel free, if you have any questions or comments that you'd like to pose throughout the meeting, feel free to send those to us. We'll be recording those onto a virtual board. And then most importantly, as I said earlier, we'll have time for that breakout discussion. But after this meeting, there will also be opportunities on the project website at shapessf.com, where there's going to be surveys and interactive documents, which each of these policy frameworks that we're speaking of, the entire document will be on the website. You could read through it, provide comment that way, and we'll show you a little bit of examples of how that works, but essentially providing comments. Others could comment on top of comments and up and down vote. Again, a real interactive way to stay involved in the process, and that'll be true after every single one of these topical meetings. So we'll talk a little bit more of that as we get through this meeting. So with that, we're going to start with our first Mentimeter poll. Just to get a sense really of the demographics. And to do that, we asked if you can go to www.menti.com And that could either be on your phone, that could be right on your computer that you are right now. And then once you're there, if you could please dial in this code, and this code will come back up again as we bring up the survey, but the code is 95014769. Again, that's 95014769. And once you get onto that platform, all of the questions that we're going to ask will populate right there on that same platform. And you can always go back and take the question if you don't have time to take it during these pauses that we have. So no worries on that front. But I'm hoping that gave you all enough time to access it. Here it is one more time. This is a QR code. If you have your cell phone, you can bring it right up to the screen, snap a picture of that QR code, and that'll take you right to that same site. So with that, I'm going to ask Diana to bring up the first Menti poll, and Eric will take you through it.
Thanks, Dave. Good evening, everyone. My name is Eric Yurkovich. I'm a principal at Ramey & Associates, and really excited to be here tonight for this conversation on community health, environmental justice, and equity. Diane, if you could bring up the questions in Menti, that would be terrific. So if you haven't already gone to, go to menti.com and then put in this code 95014769. And the first question is a kind of a fun one. We just want to know if you're wearing your pajamas right now, and it looks like most of you have already answered this question, and most of you are currently in regular clothes, or you're not willing to tell us. So thanks for that. You can go to the next question, Diana. So how old are you? So, throughout the general plan process, we have been really working to track who is participating in the process so that we can adjust our engagement techniques for different populations within the city. So we just want to get a sense of some of your demographic characteristics. So we have a range of folks in terms of age across the city. All right, thanks. You can go to the next one, Diana. So what is your race or ethnicity that you identify by? And again, we do this to continually track who is engaging in the South San Francisco general plan process. We use that to help with our engagement efforts and trying to get a diverse group of folks to engage in the planning process. All right, why don't you go to the next slide? And then finally, we want to know a little bit about where you live in South San Francisco, or if you don't live in South San Francisco. So these are what we call the planning sub-areas within the city. They're a little bit broader than just one individual neighborhood, but this gives us a sense of where folks are from. And if you are late to the meeting or just joining us now, you can see on the top of the screen, you can go to www.menti.com and you can use the code 95014769 and you can complete these demographic questions. All right, thanks everyone. You want to flip back over to the other slides, Dan? Oh, excuse me, sorry. There's one last question, which is, which neighborhood do you work in? So one more question. Any responses? Okay, got one. They're coming in a little slowly. A couple of them coming in now. All right, thanks everyone. I appreciate you participating. It's really helpful for us to know who is participating in the process. All right, thanks. Diana, do you want to swap the presentations now? Thank you. So my job for the next 5 minutes or so is to really talk about the general plan, what it'll address, and then some of our initial community engagement that we've done to date. And then I'm going to hand it over to my colleague, Diana Benitez, to talk about the policy frameworks and existing context for health and environmental justice. As many of you know, every city and county in California is required by the state to have and regularly maintain a general plan. The plan itself sets forth a 20-year vision for the future that builds on community strengths and assets while tackling new and emerging challenges. The general plan itself guides both future policy development as well as development applications in the city. And tonight you're going to hear a lot about a bill called Senate Bill 1000, which really requires cities now to tackle environmental justice and health issues within the communities. And go to the next slide. This graphic shows the simplified process for the general plan update. We kicked off the process with a discovery phase, reviewing existing conditions, reviewing the existing policy frameworks within the city, and publishing a series of reports, including one on health and environmental justice, which Diana will talk about tonight. We then worked with the community and the advisory committee to really understand what you all love about the city and what you'd like to see in the future. And that really helped shape up some of the draft vision, core values, and guiding principles language that I'll talk about in a moment. We then moved into a phase where we talked about the land use and mobility alternatives. And now we're really entering into this part of the process where we start to talk about the general plan policy across all the different elements. Next slide. And then during this process, we've completed a significant number of community engagement activities. And this slide includes a snapshot of some of those activities. These include in-person activities like visioning workshops and sub-area meetings. And during the COVID-19 pandemic, we really pivoted to virtual engagement. Those include virtual workshops, online surveys, and more. And next, you can go to the next slide. And during the engagement process, it really helped us to understand what some of the key issues were, but also areas that you were thinking about in terms of policy and program development. And this graphic really illustrates a few of those ideas that were shared during the land use and mobility alternatives process. And a lot of this information has been directly integrated into the policy frameworks that you'll be reviewing tonight and then over the next several weeks. You can go to the next slide. Now, these community conversations are really an interim step in developing the chapters, or what are called elements, of the general plan. And during the series of community conversations that we'll be having, we're going to be presenting a series of draft policy frameworks. Now, these, as Dave mentioned, are kind of physical documents that live at the ShapeSSF.net website, which you can go and read in detail, and we'll give you a synthesis of those. But these are really intended to be kind of an initial draft of those goals, policies, and implementation actions that you guys can give us feedback on now before we have a full draft written general plan. And we wanted to make them kind of as easy to understand and digestible as possible. So you won't see everything in those frameworks, but let us know if there's something that's missing that you think is really important, because we'll want to make sure they're in the final general plan. Go to the next slide. And as I mentioned earlier, initial step in the general plan process was to draft the community vision and guiding principles. And as you think about the policy framework today around health, equity, environmental justice, consider whether or not it's really working towards that vision statement with those core values in mind. Next slide. The community vision really provides that umbrella for the whole general plan and articulates where we want to be in 2040. So South San Francisco is a place where everyone can thrive. It's high quality of life, diverse and inclusive community, livable neighborhoods, excellent services, culture of innovation, and environmental leadership ensure all people have an equitable opportunity to reach their full potential. Next slide. Throughout the engagement process, we heard a series of values or beliefs that were really shared across a lot of the community members. These included innovation, sustainability, equity and inclusion, and livability. And while the vision really tells us where we want to be in the future, and the goals, policies, and actions that we're going to talk about later are what we're going to do in the future, the community's values really articulate how we're going to implement those different activities into the future. Next slide. And then finally, the guiding principles really define the key outcomes that we worked with the community to kind of understand. These include safe and affordable neighborhoods, high quality services, safe and convenient transportation, a resilient community, a vibrant downtown, and a prosperous economy. And now I'm going to pause here and we're going to switch over in presentations. And I'd like to introduce my colleague, Diana Benitez from Raymond Associates, who will really walk through the health, environmental justice, and equity policy frameworks.
Hi, everyone. My name is Diana. I'm going to start us off by talking about healthy communities. Now, this is a framework that we're using in the general plan to make sure that we improve the quality of life for everyone, but particularly for those that are currently experiencing the greatest inequities and unmet needs. So when we usually talk about a community's health or an individual's health, you're usually thinking about things like people needing to eat well, needing to stay active, and making sure that they see a doctor at least once a year. But when we talk about health, we're talking about those things, but we're also talking about a lot more, like what you're seeing on the screen right now. So things like access to social and economic opportunities, the quality of education, the conditions of your neighborhood, workplace safety, the cleanliness of water and air, ability to have safe housing and shelter, those types of things. And what we've learned is that these conditions influence why some people are healthier than others and why where people live and work matter when it comes to community health. And that's why, as we're working through the general plan, we're looking at this healthy communities framework, but we're also applying something that we're calling a social equity lens. And so I'm sure that some of you are asking yourselves, like, what is social equity? I've heard of social equality, but not equity. And so I want to break it down a bit for you. So when we talk about equality, we mean that everyone is receiving the same thing or resource or support regardless of other factors. And so I have a blue diagram to the left, and under equality, you'll notice that the boxes stand for those resources or the support that folks are receiving. And so everyone is receiving the same level, but you'll notice that everyone has varying heights. And so there's gaps in terms of the support that they're receiving at the end of the day. But when we talk about equity, we're talking about making sure that people have access to the same opportunities to be able to thrive and succeed. And so when we start talking about applying an equity lens, we understand that many people have different starting points, so different heights. So the graphic that I have to the right, and they may need different types or levels of support, so different sized boxes, to make sure that they're able to flourish. Because at the end of the day, we want South San Francisco to be a place where socioeconomic and environmental factors that include things like race, income, education, or place, but those things can no longer be used to predict health, economic, or other well-being outcomes. Because I also want to emphasize that those factors that I just mentioned, they're not decided by an individual alone. These are factors that are impacted by policies and laws, and sometimes they can negatively affect certain communities while positively helping others. And that's why we're applying not just that healthy framework, where we're making sure that people have access to safe shelter and people have educational and economic opportunities, but we're also applying this equity lens. And I'm going to take a few moments to talk about 3 different data points from research that we did in the last few years for the region and also for the city. And so I want to start with life expectancy, because when we're talking about health, that's one of the first things that we think of. And so this is data for the county, for San Mateo. And in San Mateo County, a Pacific Islander or African American child is likely to live 9 to 10 years less than an Asian or white child. Now that's 10 years, that's a long time. And when we start to think about this, if you think back to those hexagons that I showed you, it's related to a lot of different stresses. Like, for example, it could be related to pollution in someone's neighborhood that can lead to asthma or other respiratory illnesses. It can be related to displacement from their home, and that leads to housing instability. It could be related to not having access to healthy food, and that can lead to malnutrition. And also the stress of racism is something really real, and it can impact folks' ability to have access to resources, or it can even end their life. And so I just wanted to start with a bigger picture, a health example. And I wanted to also emphasize, like Eric mentioned, that the state is starting to think about how they can support under-resourced communities from a health perspective. And so Eric had mentioned Senate Bill 1000. And so that bill, or it's also called the Environmental Justice Bill, it was passed in 2016 with a focus to reduce harmful pollutants that were associated to health risks in what they call disadvantaged communities. And at the end of the day, they also wanted to make sure to promote equitable access to health benefits, and they wanted to promote transparency and public engagement. And so any city that is updating their general plan, they have to have an environmental justice element, which is why I'm here talking to you today about health, equity, and environmental justice. And one of the aspects of that bill is that we have to make a map like this one, where we take into consideration areas of high pollution, which are the areas in pink, and then low-income areas, which are the areas in blue. And I will emphasize that we made this map in 2019, and the state has now is finalizing their updated version of Cal EnviroScreen, and so this map will be changing a bit. But I did want you to note that downtown is highlighted twice, in the pink and the blue. And I wanted to show you another map. We also looked at housing displacement risk. And so we looked at it across 3 different buckets: vulnerable population, vulnerable housing stock, and neighborhood characteristics and market pressure. And just to give you a bit of perspective on, like, there were a lot of indicators in those 3 buckets. It included things like lower median income, majority renter households, buildings that had expiring affordability restrictions, as well as rapid increases in rents or sales prices. And you'll notice that downtown is 3 for 3. They have check marks on all 3 of the buckets. And then you'll notice that there are a few other sub areas that have 1 to 2 of these buckets highlighted. And that includes Stein Hill, El Camino, Sunshine Gardens, Orange Park, and Avalon. And so as these were just 3 data points, I have a whole lot more information in those existing conditions reports and other presentations that we've done. But I wanted to explain to you a bit on, as we start thinking about that healthy framework and we start looking at things from a social equity lens, we start thinking about who is being impacted and who is experiencing worse outcomes or may experience worse outcomes. And so as we start thinking about this, and I started showing you this data, some of you may have seen yourselves in the data, or you may have seen neighbors or family members or friends. And I just want to emphasize once again that these communities are impacted by policies and laws that have negatively affected them. And so this includes like communities of color, it includes children and older adults, low-income populations, people who are houseless, people who don't speak English very well, people who lack health insurance, those who live or work near fire or flooding-prone areas, renters, and populations with chronic and acute illnesses like asthma. So I just wanted to emphasize that perspective. And then I also wanted to restate that these populations are impacted because they don't have that same access to resources. When I was showing you that diagram on the difference between equity and equality. So for example, some of these folks, like if they can't make rent or if their house is flooded, they can become homeless or be hospitalized. And it'll be much harder for them to get back up on their feet. And that's why it's important as we start to think about how we're developing policies in the general plan, that we're thinking about addressing inequities, and particularly for these types of populations. And so when it comes to addressing inequities, we're also thinking about it from a procedural, distributional, and structural perspective. And so when we say procedural, it's pretty much about the way we're engaging community and we're outreaching and gathering feedback. We want to make sure that we're being transparent, fair, and inclusive, and we're treating everyone fairly. And then when it comes to distributional, we want to make sure that the policies and the actions that we're recommending in this plan, that they fairly distribute resources, benefits, and burdens, and that they prioritize resources for those communities that are experiencing those greatest inequities and unmet needs. And then last but not least, and this one is one of the hardest ones to get to, but we're going to get there, is structural, making a commitment to correct past harms and prevent future unintended consequences, as well as addressing underlying structural and institutional systems that are the root causes of social and racial inequities. And the last thing that I do want to emphasize is that we are going to have chapters that focus on equity, and then another that focuses on like health and environmental justice. But this topic of equity, it's going to be embedded in like all areas of the plan. So it's not just going to be when we talk about health impacts. And with that, I want to jump into briefly what we learned and what we heard, and then talking about the future and what these policy frameworks look like. And so in terms of what we learned as I was doing research, I saw that like more than 2/3 of the community speak the language other than English at home, that there's a decreasing jobs when it comes to service and production, that not as many people are physically active, that there's not as much access to healthy food in some neighborhoods. And as you saw in that map a few slides earlier, there are disadvantaged communities here. But I also saw that there are existing opportunities to improve access to healthy food, healthcare, and physical activity, as well as opportunities to preserve, protect, and build affordable housing and shelter. Now, from all of the community engagement that we've had, I saw that there were impacts on, concerns on impacts of future growth, as well as concerns on noise, traffic, and pollution impacts. When we talked about housing, there was concern that renters, teachers, and people of color are being priced out of the city, and that housing is getting unaffordable, and that's led to a lot of families or a lot of people living in one apartment or one house. And that there's also been an increase in the number of like Latinos, older adults, and people with disabilities that have no home. And then from a community perspective, we heard a lot that South San Francisco is a welcoming and diverse community. But even with that, we also heard that some members of the Latino community feel ignored in some instances when it comes to engaging folks in the language that they're most comfortable with, or getting resources in their neighborhoods. And then when it came to healthcare services, we heard that folks wanted mental health centers for youth and young adults, and that they wanted to see more grocery stores and more community food gardens. Now, where we want to be in the future, as Eric had mentioned, we are presenting you with policy frameworks, and these are an interim step. I want to emphasize that in a few minutes, I'm going to be going over really filled slides that are going to have a lot of text, and I'm going to briefly summarize them. And you're probably going to feel like it's a lot, but we have these documents for you to review after, and they're going to be open for a month, and you can add comments. And we have them in both English and Spanish. And so these policy frameworks are initial general ideas that we have for policy directions. And it's not a final list, but we really want to get your feedback on the policies that we've framed and the different ideas that we have. And also just want to note that there will be additional policies and measures that will be included in the general plan. And with that, I also just wanted to emphasize the way we've structured this is we have these outcomes at the very top that I'm going to start with that talk about where we want to be by 2040, and they're very visionary. And then we go into goals that express the community values and the direction. And then we have policies and measures that talk about like how the city is going to partner to do something, or just continuing to guide decision-making to show how we're going to make sure to reach those goals and then eventually those outcomes. And we also, this whole general plan is very data-driven. So we have performance metrics data to make sure that we are holding the general plan accountable, that if we say that this is going to be an outcome we're going to reach, that we can actually reach it because we're going to be tracking data. And we're also going to have targets, so goals of like increasing or decreasing something, or by 2040 getting it to a certain number or a certain percentage. And so you'll see a little bit more of that. And so in terms of desired outcomes, since I'm talking to you about equity and then health and environmental justice, we have 6. And so the first 2 focus on equity. They're talking about race no longer determining one's socioeconomic or health outcomes in South San Francisco, and that everyone has that opportunity to thrive. And then there's another one that focuses on the city applying an inclusive engagement process that allows everyone to take part in city decision-making that impacts their lives. And then from a health and environmental justice perspective, we have 5. One that focuses on a high quality of life for residents of all ages, incomes, levels, and abilities, and emphasizing that we want to increase life expectancy and especially reducing disparities between racial groups. And then we have another one that focuses on all residents having access to high quality preventive and health services. And we have another one about, we want to make sure that all residents breathe clean air, no matter in what neighborhood they live in. We have our 4th one, that all children have access to affordable childcare and universal pre-K. And then we have one of residents having convenient access to opportunities near their houses so that they can be physically active. And with that, we also have 6 performance metrics. And so one focuses on making sure that the city conducts equity impact assessments and that there's capacity building trainings done annually. When I go into the goals, I'm going to dive a bit deeper into this. And then we also have engagement touches. So making sure that when we're engaging folks, we're increasing the number of folks who are engaging in different languages and then different races, and also emphasizing various disabilities, because these are sometimes populations that get lost in the shuffle or that we don't always fully reach out to. And then from a health and environmental justice perspective, there's life expectancy, once again by race and ethnicity. So making sure that there's an increase in the life expectancy for communities of color, and especially closing that disparity gap that I mentioned, that like decade gap, as well as increasing preventive care for adults. So making sure that the first time they're seeing a doctor in a year isn't in the emergency room, that they're actually going to the doctor once a year and having their checkup. We also want to make sure that we decrease asthma-related emergency department visits, and that we increase physical activity that kids take part in. Okay, and so now we're jumping into those goals. So our first one, I think I have 10. So our first one is being a leader by collaborating across departments and jurisdictions to incorporate equity considerations into policies and programs. And this goal really focuses internally, citywide. So it focuses, like I said, on organizational capacity, because we want city staff to be able to apply an equity lens into their day-to-day work. So for example, if the Parks Department is deciding where a new park is going to go, or what amenities are going to be updating first, it would be great for them to do an equity impact analysis so they can make sure that the services are equitably distributed throughout the city. Another thing is making sure that city staff, boards, commissions are reflective of the diversity. So race, ethnicity, gender, and the different languages spoken in the city. Now, we're going to be giving examples of some emerging practices. And so you actually have one that was actually happening a little earlier today. I think it ended, but the South San Francisco Commission on Racial and Social Equity has gotten a lot of community members and a lot of city staff together to really think about how the city, not just on land use things that relate to the general plan, but a lot of other topics, how you can have different policies and actions to make improvements in the community. And I know that right now they're in phase 2, they're about to finalize recommendations, but I think when they started this phase, they had like 30 different strategies and they had to narrow it down. But I know they're talking about things like educational access, so like things like tutoring. I know they're focusing on like reimagining safety. I know they're also talking about access to mental health services, just to name a few. And one of the things that I do want to mention is that once they finalize those recommendations in July, we're going to be taking those into consideration, and they're going to make some of those are going to make it into the general plan, especially into the health and environmental sections and the equity section. Another goal that we have is engaging all residents in decisions that impact their lives. And so this one is really focused on engagement. So hiring staff who speak multiple languages. So when folks who aren't as comfortable in English approach the city to ask questions, they feel comfortable and they feel heard. This also focuses on making sure that there's multilingual interpretation and translation at community meetings, like right now. Thank you, Jasmine. This also includes things like data transparency, where some cities have open data portals where they have things like city budgets, engagement demographics, police use of force data, all information so that that residents are able to see the data and they're able to, hold the city accountable and also hold the general plan accountable. We also have another goal of being a leader in promoting healthy communities through things like collaboration, prevention, and education. And that focuses on things like continuing and making new partnerships with different agencies in San Mateo County to improve like mental health services, continue like the homeless services that you have in the region. This also focuses on private and public partnerships to provide medical, dental, and mental health services, as well as pharmacies in under-resourced areas, like in downtown, but also taking into consideration in potential new residential areas, like Lindenville and east of 101. This also includes things like creating a community drop-in center for people without homes to look for housing and jobs, but also provide food and computer access, restrooms, and case managers. We also have another goal of closing the gap on healthy food options for low-income residents. And that includes things like creating a new grocery store in like downtown or east of 101. This also includes thinking about how to expand farmers markets and encouraging things like fruit trees or community gardens and city parks or public spaces throughout the city. And I do have an emerging practice example that's happening in the East Bay. In Oakland, they have worker co-ops that are grocery stores. And so they have one in West Oakland that's more than a decade old, and they have one in East Oakland that they're just fundraising for. But these are a community way to say, we need a grocery store and this is how we're going to create it. They help to create dignified jobs that have living wages. And when you're a worker co-owner, you have a stake in the company and the organization. And then in Oakland in particular, they emphasize that they only want local food from Black and brown farmers. And they also provide healthy, affordable food for their community. And because their community members can work there and they also have access to food, it helps to build community assets and wealth. And so I just wanted to give that as an example of something that's happening in the Bay Area. Now, we're almost done. I think we have 3 more goals. We have support safe housing and shelter throughout South San Francisco. And so there's a few programs for people with homes, and then there's programs for people without homes. For people with homes, that includes making sure that we have safer homes for older adults. So things like making sure that if you have older adults that live on the 4th floor and the 3rd floor of an apartment building, seeing if you can work with the property manager to get them onto the 1st floor to make it safer when it comes to stairs or elevator, and then adding guardrails to bathrooms and things. So there's a county department that helps cities with that. Also, making sure that we're tracking the inspections of publicly subsidized units that HUD has, so we can make sure that all housing in South San Francisco is safe. For programs for people without homes, it can include things like having mobile shower, bathroom, and needle exchange sites and facilities for those without homes. And also things like partnering with the local shelter to provide cots for emergency shelter situations, which from what I've heard recently, especially with COVID, they've had really high numbers in their shelter. Another goal is protecting vulnerable households from displacement. And so that includes things like developing an anti-displacement plan. If you remember the housing map that I showed earlier, included a few sub areas. So like for downtown, Pine Hill, El Camino, and Sunshine Gardens, it can be citywide, but making sure that you focus in on those areas. It can look like having foreclosure assistance to help homeowners that are at risk of foreclosure. And it can also include encouraging different types of home ownership. That's like resident controlled limited equity ownership, things like condominiums or housing cooperatives or community land trusts. And an emerging practice is that a lot of cities and regions have been developing anti-displacement plans. And so usually when we talk about housing, it's usually split into three things. You talk about the production of affordable housing and how the city is going to set incentives so that they can get affordable housing. Then there's the protection and support that includes for tenants and homeowners. And then the third one is preservation. So thinking about existing affordable housing units and how to keep them. And so I've included a few examples like in Fresno and Portland and in San Jose. And these, I know because I wrote them all down, but these include things, they have policies like having a rent board, doing like just cause evictions, having rental assistance, rent stabilization policies. And then also some of these cities like in San Jose, they did this in anticipation because they knew that a lot of development was going to be happening. And so they wanted to be proactive to make sure that they could protect their community and their residents and really listen to their concerns. And so an anti-displacement plan is an example of an emerging practice. Now, I think this is my last one. We have reducing air pollution exposures near freeways and industrial uses, and that also includes things like biotech. This includes things like purchasing air quality monitoring devices. I think there's only like one in your region, and I think it's close to east of 101, but it helps, especially if there's going to be new residential areas in east of 101 and Lindenville to have more local ones, so you can be tracking that information. This also includes things like having up-to-date truck routes mapped and managing truck idling. So that means that when these big rigs, sometimes they park and they leave their trucks on, and they can leave them for hours on end, and so the diesel keeps pumping. And so making sure that that's not happening near residential neighborhoods, and making sure that the truck routes, minimizing the exposure to residential areas and schools and parks. Another thing that we also want to take into consideration is when it comes to new developments or existing buildings near these types of uses, to make sure that they add appropriate measures to reduce indoor air pollution. And that includes things like making sure that there's air filtration systems in place and that there's landscaping, among other things. And I do just want to share one more emerging practice. In Los Angeles, there's a program called Clean Up Green Up that was passed in 2016 via ordinance. And they essentially have a buffer zone of 500 feet between new or expanded auto-related uses and residents. And this is particularly in southern like Los Angeles County, where they have the cities of Pacoima, they have Boyle Heights, and they have Wilmington. And so they also have mandatory air filters in all new residential units within 1,000 feet. And then they make sure that those trucks aren't parked with their, when they're not turned on. And they have a lot of signage for diesel trucks at warehouses so that they'll comply. They also do things like improved site planning, where they're saying, okay, we know that air pollution is a thing, but there's also other types of pollution. So there's like trash that can have like different smells, or hazardous materials, or outdoor lighting. I can give you a personal example. My family in Los Angeles, when I go to visit, I stay in a room where the building right next door is an industrial building, and they have a really bright light that they shine directly into my room. And so anytime I want to go to sleep, I have a system where I set up pillows, or like I tie things so that none of the light reaches, because they need that light as a security measure to protect. But if I don't make sure to like reinforce my window, like I can stay up all night because that light is bothering me. But like in these areas of Los Angeles, they work with these industrial like businesses to make sure that they're not impacting the residential areas like that. And then the last thing is that they have small business support, where they not only work to improve their operations to reduce air pollution, but from a sustainability perspective, help them get to things like energy efficient buildings, and like greener trucks. and they also help them save money. And that saving money thing is a really big factor that has folks coming back to continue working on the program and to continue making improvements. And so with that, that was a brief introduction to all of those goals and policies. And now I'm going to pass it on to Eric so he can talk about a few of our Mentimeter questions.
Thank you, Diana, for that terrific presentation. We did get a few comments and questions in the chat, which we will take in the small group discussions. Thanks for including those, and we'll talk about those in a minute, but feel free to chat in things as they come up. So again, we're going to do just a few Mentimeter questions. We're going to start with a very simple one, which is, have you attended a Shape SSF event in the past? So you can just kind of tell us if you have. And if you were not here earlier, you can go to www.menti.com. You'll see it on the top of your screen here. And you type in the code 95014769. And then you can answer these questions. We have one person, so I'm going to give folks just a minute to get to menti.com and answer these questions. Thanks. And we have a few folks who have attended events in the past. Okay, you can go ahead and go to the next question. All right, so we kind of just want to get a general sense of your perspective on a few different questions. And these are going to be in the policy framework, and we'll talk about them a little bit more. So on a scale of kind of agree to disagree, what do you think about the idea that South San Francisco staff, boards, and commissions are reflective of the city's diversity? So just tell us on a scale of kind of strongly agree to strongly disagree. The second one is that the city should hire staff who speak multiple languages, things like Spanish, Mandarin, and Tagalog. And the third question is about having multilingual interpretation and translation at community meetings like we have with Jasmine tonight. Just to give your perspective on those things. There we go. One more vote in. All right, go to the next one. Go ahead. And so again, this is another series of questions where we just want to get your initial perspective on these things. So first is, do we want to encourage resident ownership? So things like condominiums, cooperatives, community land trusts. And these are really an opportunity to build generational wealth and help with a lot of inequities that maybe exist within South San Francisco and many communities where people don't have access to home ownership. And then we get some votes in. Second is to develop an anti-displacement plan. And the third is to partner with the local shelters to provide more cots for emergencies. Thanks for you all to respond, and we can move on to the next one. There's a lot of support for those. And then finally, we want your perspective on just three other ideas. So the first is to create a drop-in center for people without homes. So people who are unsheltered, so they might have access to showers, to food, maybe to internet, electricity, and many other things, clean water. And the second is really to get your perspective on working with developers to create a grocery store downtown or east of 101. And the third statement is buildings in Lindenville must reduce indoor air pollution. So these are some of the things we heard throughout the community engagement process and are part of those policy frameworks. We're just getting a few votes in, so give you all another minute or two. There we go. Again, pretty strong support for these ideas. I think with that, that's our last Mentimeter question, and I'll hand it back over to Dave. Thanks, everyone.
Great. Thank you so much, Eric, and great presentation again, Diana. So as Eric mentioned, we did have a few comments coming through the chat, and considering we have about 8 folks from the community and we're well staffed here with both project team members and city staff, I think it might be best if we stay right here within this main group so we can save time from the shuffling back and forth between small groups and have a great discussion with you all here. So don't worry about the first 2 points there, or the third point. Really, we'll kind of have the discussion report back here. We would like to have you all introduce each other to start. And then if we can click to the next slide, just some big picture questions that we typically like to ask, and we'll kind of dive into this a little bit deeper as we get into it. But other outcomes other than what Diana mentioned tonight that you'd like us to consider, and of the policy measures, which one you like best. Again, we'll bring those back up on the screen. And then if there's other ideas that weren't listed that we should consider, and we have a couple that came through chat that I like folks to verbalize. And then anything else you'd like to share about this topic would also be beneficial for us to consider here tonight. So I'd say let's go ahead and stop the PowerPoint. We'll bring the PowerPoint back up at the end so that we can kind of talk a little bit about next steps, about meetings that are upcoming and what you could look forward to. But maybe just to get started here, if you all wouldn't mind turning your cameras on, if you're comfortable doing so we can see all your friendly faces, and maybe do just a quick round of introductions. And then given our topical expert, Diana, I'm going to turn it back over to her to help facilitate our conversation here. And I might start with a couple notes that we got through chat. So we've done this before where we call on one person and you just kind of tell us your name, any interest you might have. And then last night or yesterday, we did one thing that we might all not know about you, but you're welcome to throw in whatever you'd like just to introduce yourself. And I'm going to go ahead and start with Antonio. You're up.
Hi there. Antonio is actually a pair of two, Antonio and Dane.
Awesome.
San Francisco resident, or South San Francisco residents in the downtown area. There were a number of, first off, I just want to say, Diana, the fantastic presentation. Being involved in different kind of community development plans in the Pacific Northwest, primarily Seattle, and focused in on diversity, equity, and inclusion. Very, very happy to see all of the things that you are all thinking of. Some of the things that come top of mind for me were really wanting to understand from a policy perspective why individuals were focused specifically on asthma and not necessarily different comorbidities, specific to the fact of the racial makeup of South San Francisco is so unique. And I think there is definitely some trackable, monitorable health outcomes that we could look at based on other comorbidities such as diabetes, obesity, others. And the other thing that I saw work really well as part of sustainability and looking at food disparities and health disparities in Seattle was really focused in on food deserts and individual pop-ups where we could potentially be working with farmers and other organizations to almost have pop-ups in specific areas in which there is an appropriate nutrition. And just wanted to see how that came into place, or if it was thought of at all. And the last piece was really around Portland's policy in housing. I can't remember exactly which piece it was, but there were 3 different strategies you were looking at. Housing, Portland was one example. From there, I was also looking at the consideration of housing laws and zoning, where we know that at this point in time, there's a specific square footage that's needed for ADUs or other kind of like sub-housing infrastructures that you could create or build on your property. And knowing that Portland's done a really good job of ensuring that they've minimized the actual square footage that's required on land in order to have a sustainable housing added as a footprint for consideration for other populations. I'm sorry I took a lot of time, but those are the 3 things that were on top of my mind.
No problem at all. Thank you so much for giving that so much thought. Initially, we were going to do introductions, but we might as well do introductions and take comments and questions at the same time. And
Sorry.
No, all good, all good. That was
I had a beer already. I'm sorry.
all good. No, we love all the comments, and you also provided a resource through chat, which we greatly appreciate. Any information that you all have as resident experts in your own right that you can share with us, we greatly appreciate. Diana, I know that was a lot to absorb all at once. Did you have some initial thoughts on some of Antonio's thoughts?
Yeah. Thank you for bringing up the other different comorbidities. I think when Eric and I were starting to think about performance metrics, we have an internal list of about 60 different metrics. And so what we ended up realizing is can't have 60 metrics. We've seen plans that have like 100 metrics and it's just too much. And so we were trying to narrow it down. And I think as we were talking about the different feedback that we were getting in terms of air pollution, and we also have CalEnviro screen that has the connected topic of asthma. And so that's why I took that into consideration. And there was also, I could switch, like instead of having the physical activity, we can talk about like diabetes or obesity instead, because in my existing conditions report, we do have data on diabetes and we do have data on obesity, but I think I thought of thinking of it from in California, we have the UCLA CHIS data set, and so they do data locally and they look at the physical activity levels for adults and children, and so I was looking at it from that perspective. But thank you for reminding me that it's not just air pollution, that I should include others. And I can do that. And then in terms of the food disparities and the food deserts, we had thought of things like pop-ups, which is why we had things like farmers markets, but I know that that's kind of like an old school way of thinking of them. But I do like the idea of having other opportunities. They don't have to necessarily be connected to just farmers markets. And then in terms of the Portland housing, you'll notice that the goals that I talked when it came to housing were focused on tenant protections and maybe a bit on preservation. That's because the general plan, there's going to be a housing element that's going to come a little bit later this year. And so they're the ones that are focusing a lot more on the production, and they're also going to touch on the preservation and on the tenant protections. But because it was something that everyone was really concerned about and that everyone was talking about, we ended up adding in those types of policies. But you bring good points, and I know in South San Francisco, they do allow ADUs, but I know that it's been slow going in terms of getting more ADUs. And then Eric, did you want to add anything else to that, or is that cool?
No, I think that's a good synopsis. So let's get who would like to introduce themselves next. I'm going to point at Janice, and then Janice, after you introduce yourself, I want you to pick the next person to introduce yourself.
Just introduce myself with no questions. Okay. I'm Janice Ortega. I live in the Westboro area. I'm a retired secretary from the East Bay school system, and I'm living in a home. A friend of a friend told me about this 93-year-old woman who had a stroke and needed someone to live with her and be there at night in case she falls. So since her daytime caregiver quit when COVID started, I've just stayed with her 24 hours a day. So that's my situation. I've been in South San Francisco for 3 years. So to pick someone else, I'm looking, Billy, you're a staff member, right? Hermes Monzon?
Yes, thank you, Janice. My name is Hermes Monzon. I live in the Old Town, downtown area. Sorry, I came late to this meeting because I was on the Social and Racial Equity Commission meeting. Part of it, I would like to, we discussed before about the park in a downtown area, Old Town area, for our health, for our youth and senior health. And I think we discussed on the phase 1 that this is the time to build the policies, and we would like to bring that one up again on the table. I heard a few ideas of just wondering if you guys are up to speed on the ideas and if the park is going to happen or we're discussing or not.
Yeah, Diana, do you want to go ahead and respond to that? And then
Yeah,
Janice,
yeah,
if you
I
did have
can.
a question, we can definitely come back to you as well and then get around to the members of the
Yeah.
public before we introduce ourselves. So go ahead, Diana.
So we are having something like 11 different meetings and they're focusing on a lot of different topics. You'll notice that like I touched on like physical activity, and if you dive deeper into like the framework that I was working on, I take into consideration what I'm not looking at anything parks related because there's another parks element and there's another parks meeting that I'm going to be speaking at and my coworker Megan's going to be speaking at. After we finish this, we have a slide that says when it's happening, but it's happening next week. It's going to focus on parks, conservation, and cultural resources. And so we'll have, it's pretty much most of the goals are on parks because that's a lot of what we heard. And so that's why you didn't see any mention of parks in this section. So don't worry, we have stuff, and we also mentioned downtown in particular for some of these.
Thank you.
Thank you, Diana and Hermes. Why don't we go to Sarah next?
Okay, hi everyone. My name is Sarah Funes. I live in Avalon Park. I've been a resident of South City basically since 2002, except when I went to college at Cal. I went and lived there from 2014, 2018. My three top concerns are more transportation in and out of all the neighborhoods. I currently don't have a bus line in or out of Avalon Park. I don't even get the free shuttle. As a disabled person, I can't drive. So unless my mother or my partner wants to drive me somewhere, I'm pretty much stuck unless I want to use my Segway, which is really cold right now. Second would be, yes, doing more pop-ups and farmers markets, especially since we have Ponderosa in Avalon Park. Having bus lines to places to get groceries would be really helpful because that doesn't exist. And the third thing is just getting more access to downtown through transportation. I would love to, I know this is Park and Recs, but I would love for the city to have like rentable bikes to like in existing parks, and really look at getting zip cars in every district in the city because I don't feel like people, and that's it.
Thank you so much, Sarah.
My immediate response is that tomorrow, actually, we're having a conversation just on mobility. And so once again, like transportation was on my like hexagons of healthy communities, but I didn't touch on them because there's a whole other chapter that's going to focus on that. And so I'm going to make sure to, at the end of the night, to pass these on to Taylor. So when she's speaking tomorrow, that she knows that this is some of the feedback that we've already been getting. But thank you. Thank you. This helps.
Thank you so much. Yeah.
Matt, would you like to speak?
Hi, sorry about that. Just had the phone away from me for a moment. Matt Jacobs. I do not live in the city of South San Francisco. I have worked in and out of the city of San Francisco for the last 9 years for Kaiser Permanente doing community government relations. And I just kind of want to make a comment that we've been doing community health needs assessments in the area for the last 15, 20, 30, 40, however many years. And I think those would be a great resource. And we give our grants out in the community, and those, really do work toward health equity. So I think maybe kind of using some of our information might be of help. That's public online on our community health website. So I just wanted to kind of make that point. I'm not trying to plug our organization. I'm just saying those resources are there.
Thank you. And I think we did. Oh, go for it.
Good. Great.
You go. I was just going to ask Matt if you could. Thank you. If you could drop the link to those in the chat for everyone, that would be terrific.
I will do my best. I'm taking this on my phone, so it's 50-50.
And I just wanted to add that I did take a look at quite a few of them, but if I remember correctly, your community health needs assessment also includes like Redwood and other regions, and so we did take a look at the data, but then when it came to trying to select things, we tried to select indicators that had data that was like specifically for the city. So correct me if I'm wrong, but I do remember looking at a community health needs assessment that looked at like the southern portion of San Mateo County, or like a portion.
Yeah, we have that one, and typically, if my understanding is correct, I unfortunately don't work in it directly, and it's changed a little bit over the last couple of years. But my understanding is that we typically, we do need to do a health needs assessment for the South San Francisco Medical Center itself. So that's the areas around South San Francisco. Even though we do it in combination with Redwood City or in combination with our San Francisco facility, we do the work together. But my understanding is we do have to have the information per medical center. But don't quote me on that because I know a lot of things are countywide too. So I'll put the link in the chat, and yeah, I just know, it's what informs our grants, and our grants are really following what those needs are. And I think that's kind of where those partnerships are happening that could really help address some of those needs, because they can go beyond what we do, because, we only have so much money. So.
No, agreed. And I know you also have localized zip code data that we can use, because South San Francisco is just one zip code, and it makes it easier from a data perspective.
Yeah.
Thank you.
Sure.
Thanks, Matt. Very helpful. I don't think we've heard from Laura yet. Laura, are you with us? Nope. Okay. Feel free to unmute yourself if you'd like to contribute. Laura, how about David H?
Trying to unmute here. Sorry, I'm no problem. I am working east of 101, and I'm just interested in hearing what's going on in the community and how the general plan is developing.
Great.
No specific questions otherwise.
Okay, great. Well, thank you for joining us. We appreciate it. Thank you. Janice, I want to come back to you if you had a question to ask or comment.
Yes. The issue that worries me the most is the anti-displacement. So I really like the presentation. I felt that for me, the more information, the better. So the full slides are great. The pace was very good for me to understand and actually capture what you were saying. First of all, I wanted to say, someone talked about the asthma and diabetes and obesity. And I wonder if you have gotten data from the school system about what the children in our community are suffering from the most. The other thing, with this COVID situation and the pauses on the evictions, I just think that one day they're just going to release those anti-eviction orders, and people are just going to be evicted left and right. So I think the housing program, if we thought it was bad before, I think it's just really going to explode. And one thing is, my daughter is a teacher in San Francisco. A lot of families, you don't know that they're homeless, but the kids talk about it in school. So the teachers know, the nurses know, the school counselors know, the principal and vice principal, they know the situation of the children and a lot of the needs of the families. I think we've always had a lot of homeless college students. And so that's going to be worse. Everything's just going to be worse. And since we live in a capitalist system, people are going to be left hanging out to dry, worse than before. I like the idea of the ADUs. I think now is the time to really push for opening up the policies on that. I think a lot of people after COVID and being separated from their families are going to want to have their families come and live closer to them, especially if they're still out of job and don't have resources. I know there's a program, I think it's called home sharing. I stumbled into my situation where a friend of a friend just said, could you come and live with this elderly woman? I know there's a program for that. I know that it's very scary for an elderly person to open up their home to someone they don't know. But I was thinking you could try to work like church people with church people, work within that community together to identify who has a home, who has space, and who has a need. Maybe even in the schools, work with like to like, identify who has a need and who has resources that they can help with. I know it's a huge job. There's a lot of pitfalls to it, but when it works, it really works wonderfully well. I think that's all I had. Thank you. This is great.
Thank you so much, Janice. Great information. Diana, did you have a thought?
Yeah, I wanted to mention in terms of data from school system, we look at food insecurity, the reduced lunches that kids can get, and then we also were looking at physical activity. The metric on children and physical activities is based on like the physical fitness test coming from the school. And then I know there's a consideration. I know that it doesn't, I was looking at the data set here in California. They may have updated it to do better, but they consider like areas with like high lead, and they do it by a school district thing, and it's based on like surveys, so it's a small sample size, but then they draw assumptions based on that. But those are the types of things related to like the school system that we were looking at data-wise. And then I would want to say that the home sharing app sounds like a cool idea. I don't know how feasible it is at a citywide level. I do remember, I'm gonna have to go back to my notes, but a few years ago, the city of West Hollywood, I helped to work on like a health plan, and there was an emphasis, I forget what the frame is, but having having households with multiple generations. And so opportunities to see like college students can connect with older adults so that they can support each other. And so there might be an opportunity to do something similar to that. So I like that idea. And then in terms of the anti-displacement and the concern on COVID moratoriums, I would give it to Billy to respond to that, because he's city staff and he's more familiar with the current policies that you all have.
And then that was for ADUs? Sorry.
No, she had two things. She was talking about pushing for more ADUs because families are going to want to be closer together. But then there was also a concern on anti-displacement that like the moratoriums and the COVID, that once everything gets better, that a lot of folks are going to be like, I can't afford all of this rent that I owe, or things of that nature.
I do know, I'm not positive on what specific anti-displacement measures we're talking about right now, but I do know that our city council, that has been an area of emphasis for them. You might have heard like some of the things we're looking at are, can we do a universal basic income type of program, or things along those lines that would pick people who are severely at risk of displacement or other negative impacts, and maybe there's a way to provide additional funding to help them make those ends meet. And so I'm sure we're going to have continued conversations to see what things can we do as a city to help with that. And so there will likely be more city council meetings that get into that in more specifics. I think next week I have a hard time. They have so many city council meetings right now that it's hard to keep track of all the different items we're talking about. But there are supposed to be some additional kind of study sessions on housing related items that I believe are coming up relatively soon. I was gonna, two other things real quick. On the pop-ups, I will say that City of South San Francisco, at least from a staff level, we completely agree with you. Our ordinances are based on, the general plan was 2000 and our zoning ordinance, the current one was 2010, when that was thought of more as a threat to the existing kind of brick and mortar businesses. But obviously these things are shown to be good for, they both can coincide very easily, and just the ease of access for those types of uses. And so we definitely will be trying to make those types of uses just mobile vendors in general, that for all purposes, easier to do. And then the other thing I was going to say is, Sharon, one of the questions that Sharon had was dealing with kind of the multi-generational or Asian in place types of policies. I know that we have some of those that were in there, probably just not in stuff that you see tonight because there's just so many policies. And so Diana can probably talk a little bit more about that. But I wanted to just, I know that that comment was put in the chat as well. I wanted to acknowledge it.
I will say the first one that comes to mind is the one that I talked about on making sure that housing is safe for older adults. And then I know that from a parks perspective, Megan made sure that there was an emphasis on like programming and facilities and amenities and access. And I know also in the transportation policies, but you brought a very good point that I think I maybe only mentioned aging in place maybe twice in this one. And I know that there's a lot of stuff that connects to transportation and parks and all this stuff, but I can include more and I should include more. So thank you for that reminder.
Great, and thank you, Billy, for being so on top of it. I was going to call on Sharon next to verbalize her comment. Sharon, did you have any follow-up thoughts on that?
I would say that I'm Sharon Reynolds. I'm the Assistant City Manager and also the Park and Recreation Director. And the city does offer a variety of programs for seniors. But one of the things that we've seen during COVID and something I'm increasingly aware of is just the impact that COVID has had on our seniors in terms of social isolation, depression. It's really quite extreme. And I just think they deserve to have that. Seniors are a very important demographic and should be called out as such. And not to be, cast stones here, but I think sometimes our diversity in terms of representation doesn't include seniors. We have a youth commission and that's awesome. I staff it, I love them, but we don't have, we don't always hear the senior perspective. And I just think it's really important. And also selfishly, we have an adult daycare program, for example, where we have seniors that need supervision during the day, a program just for them. And it's always on the chopping block. Every time there's a financial crisis, it's like, well, maybe we should eliminate that program because it's hard to do and it's not easy. So I just want to make sure that as I'm retiring, that some of these programs, get the credibility and the importance. They're just really important. So yeah, and then just two quick things is with respect to the home sharing, San Mateo County has HIP housing, which is a home sharing program, and we fund it through our CDBG funds, not entirely, but we contribute to the funding of it. And that's been around for a really long time. Gosh, 25 years maybe. And it's a really great program where they do exactly what Janice suggested. They kind of try to match what the homeowner is looking for, and then the renter. And then also just on ADUs, the city does have an ADU policy, right, Billy, which Billy knows way more about than I do, which I think citywide applies. Anybody can put in an ADU currently in South San Francisco, which was fairly new last couple of years.
We're currently just following the state regulations, yeah. But the state's made it to basically cities have to allow for it. And so I think we'll try and figure out are there ways we can streamline that? Are there prototypes and things that we could potentially put together that would allow to make it easier for people to do this if they wanted to? But that's an ongoing discussion. The only other thing I was saying, Sarah, I know at one point you had your hand up. And so it's hard keeping track of all the people, but if you have comments, please feel free to.
Yeah, so I'll say that I was up until very recently on Social Security disability insurance, and I couldn't live in South San Francisco because when you live with your family, you don't get as much. So finding a place in South City was very, very difficult, and it was impossible. So I was living in East Palo Alto and Stanford because my partner happened to live there, and we got a couple's apartment. And it's one of those things with housing where it's incredibly hard to find. I recently applied for the appointment for the city council, which I didn't get, but I did talk about a public and private partnership like HIP but something specifically for the city. And I thought that was a really good idea because there are, like, I live in Avalon Park, and there are a lot of empty rooms in these houses with these older homeowners. And there are a lot of homeless college students. I was very close to being homeless when I was at UC Berkeley. And I was like on the verge of starving as well. And it's just one of those issues where we really do need to talk about it, because once everything starts looking better and the moratoriums lift, there's going to be a huge just deluge of people who need support. And I'm really glad our city is looking at UBI. I think that's wonderful. I mean, I don't think everyone next door thinks it's wonderful, but I think it's wonderful. And yeah, when it comes to like housing and food insecurity, that's a really big problem. Like, I don't see enough when it comes to older residents that they have access to like Meals on Wheels and things like that. I just don't see enough from the city talking about HIP housing and talking about the various things that the county and the city does offer. So that's the one thing I wanted to really mention.
Thanks so much, Sarah. Appreciate that. Oh, yes.
Can I just add something to what sorry.
No problem. Go ahead.
I was just going to add something to what Sarah said, and then Hermes has his hand up as well. So I like, it came up, it's just come up in a couple of different meetings about access to information, right? So what programs are even available, and making sure that residents really understand and know those programs, and whether they're county programs, whether they're city programs. I think I've heard that, actually, we've had a couple of these meetings. That's one of the kind of the constant themes we've heard so far.
Thank you. Yeah, and I know, Antonio, you had a comment about that as well, as the support from San Mateo County, or maybe that was from Dave. So yeah, it sounds like some of that might have already gotten answered. And I just want to give you all a quick time check. I want to respect your time and try to get us out of here at 7:30. And we have a couple slides on next steps that are going to come up. But Hermes, why don't you go ahead and pose your comment or question, and then we'll work towards a wrap up.
Thank you everybody for your time. I'm just wondering why we're having 2 or 3 meetings in a week for the month of March. It's very challenging to be part of all your meetings. You guys are putting an amazing work, and I think you deserve the attention of the community, but the community cannot be, 2-3 times in a week at 11 in the morning. Yesterday I tried, I couldn't. Today I'm jumping from one meeting to another one. So I'm pretty sure there's many community members that I would like to be tonight, listen to your hard work. I'm just wondering why we're having all in a crash. Is there a deadline that we gotta finish everything by March? Why it was not spread out a little bit like more on phase one?
Great question, Hermes. Oh, go ahead, Eric, you can reply.
I apologize, you go first. Sorry, Dave, I didn't mean to cut you off. You go first.
Yeah, I was just gonna know, I mean, really good point, and it's a big crunch for us as well to kind of prepare and get all this information ready. I mean, we do want to assure you, our thought was that all of these are recorded, and it becomes a huge resource that actually gets posted to the project website. And we're going to continue to get information and feedback from folks on the platforms that are available on the website as well. We're about to talk about that a little bit here. So we fully don't anticipate that we're going to have everyone joining us at every meeting, because we know it's a huge ask. And we try to have meetings during the night and during the day, just to give folks an option and a choice, instead of having to just come to night meetings after a long day. But your point is very valid. I'll let Eric talk to the general timeline and kind of where we are in the process and how this fits in.
Thank you.
No, and I think it's right. And I think it's unfortunate that the commission meeting was tonight as well as this, and particularly because the topics overlap, right? So that's a little bit of a misstep. So sorry about that. But I think we're trying to provide as many opportunities as we can for people to provide input on the policy frameworks before they're the general plan. So, people have an opportunity in these meetings. There are these online surveys that Dave is going to talk about, and how to go and access those and comment in those online surveys, which are open for another month. So lots of people can go and get to look at those and provide their comments as well. And then once we draft the general plan, there will be another time for folks to provide their comments on the general plan. But we wanted to do it now before everything's solidified, so we can get more community input on the plan. And it is honestly super hard in the pandemic, right? We can't just have one big meeting where we sit around for 3 hours and talk and have all of these stations and people just drop in and talk about what they want to. So we kind of have to figure out how to do it in the pandemic world. So it's a little hard right now.
I do hope that when we get to the actual kind of general plan elements, the actual chapters themselves, we might be at a point then where we can start to have those open house meetings, and there can be kind of the different tables for all of the different topics, and you can start to better see how all these things interrelate as well. The hard part with some of this is because we could also do the other way where we spread it out so much to get input, but then it takes us forever to actually implement all of this. Because obviously the goal is to try and get some of the general plan adopted so you can then start to work on the specific policies more quickly. And so even with this time frame, it's still kind of early to mid next year before the entire thing gets adopted. You don't want to push it out too much, or all of a sudden then you start to look at, are you not getting to some of the actual implementation items for another couple of years? So it's this hard balancing act of trying to kind of look at the high level. How do you put all of these kind of big picture policies in place, but do it in a way where you're then able to pick the ones that you prioritize and start to implement them, but everything is moving forward. It's a big lift because there's so many different aspects to this. And so we have to push the timing a little bit too, so we don't get so bogged down in the discussion that we don't actually ever get into the actual implementation of the work. So.
And on that note, as you can see here, hopefully on my screen, so we do have a series of meetings that we're going through. We've obviously, this one tonight, we've held 2 others on sustainability and safety and climate change, which were great discussions. And again, those are now posted to the project website, and summaries will be posted there as well, those videos. And there is 7 more meetings coming. As mentioned before, the one on mobility is actually tomorrow at 11:30. I know there was some interest there. We have meetings coming up on land use, sub-area specific meetings as well on East 101, Lindenville, and downtown. And then intermixed there, we also have that conversation about parks, as Diana mentioned earlier, and we do have a conversation about housing as well coming up over the next week or so. So definitely stay tuned, and we realize it's a huge ask. If you can't make it, please do stay tuned and watch the videos and be able to kind of provide input that way. As I mentioned earlier, we do have the online presence. We've said it a few times here, I know, but there is, all these policy frameworks are on the project website at www.shapessf.com or .net/policy/frameworks. And you can go there through April 16th, as Eric mentioned, another month. And on those, you'll have an opportunity to actually provide direct comment on those policy frameworks. So you can actually add comments and comment on top of other folks' comments and up and down vote information as well. So a really interactive way to dive in and kind of really read through all this great information that's been shared in this format tonight and give us your feedback that way. Please do share that out with your folk constituents, others you know that would be interested in any of these topics. We'd love to get your feedback that way. So with that, we're right at 7:30. Just as a reminder again, shapessf.net or .com is where all this information is housed. And if you have any specific questions, your contact as always is Lisa Casa-Sanders. And you see her email address there. If you have any specific questions afterwards, feel free to reach out to us. Sure, Diana, yes.
I just wanted to add one more thing. Just as a reminder, we have these policy frameworks in English and in Spanish, all the ones for this week's meeting. For next week, the next 2 weeks, we're finishing the translations, but they'll be up. And then in all of these pages, like I have the health and environmental justice one open, we have a bunch of resources. So you can take a look at the preferred alternative. We develop fact sheets on social equity and housing and displacement. You can take a look at the existing conditions report. We had a CAC presentation that talked on equity. There was actually a housing affordability and displacement forum last year. And so we have the presentations in English and Spanish. And so there is just a lot of resources that you can look through just to get yourself more familiar, to see what we've been working on as you start responding to these. So we look forward to your feedback.
Great. Thanks so much, Diana, and great job again tonight. Thank you all for your time. Have a great evening. We hope to see you again soon.
Thanks, everyone.
Take care.
Thanks,
Bye-bye.
everybody.
Thank you.
Yeah, Ma.